So welcome to this week's episode of When Push Comes to Shove. This week we are talking about induction of labour, again with myself, Nikita, and Lola.
Hi, I'm Lola. I'm a midwife.
And I'm Nikita, and I'm a doula. So Lola, do you want to briefly explain what induction of labour is?
Yeah, so induction of labour basically is any time that we try and start off your labour before it starts naturally itself. Usually I would say an induction of labour is medical, although there are some ways in which labour can maybe be started naturally. But when we talk about induction of labour, especially in this instance, we are talking about medical induction, as in an induction that's been started in the hospital by the medical professionals, so, and that being the midwives or the obstetricians.
Okay, and what does that involve?
So induction of labour can take many shapes and forms. The first thing that we need to do if we are trying to induce a woman who has not gone into labour is to try and open the cervix. So for those of you that are familiar with the anatomy and physiology, the mum-to-be is carrying the baby in her uterus, and at the end of that uterus is the opening, which is the cervix, which opens to let the baby out when the mum's in labour. That cervix is usually closed and has a length to it, so it's almost like a little tube. And when the mum goes into labour naturally by herself, it softens and then it flattens before it starts to open. So part one of a sort of medical or obstetric induction would involve trying to soften that cervix with medication and trying to open the cervix as well. And that can be done with some pessaries and sometimes with a balloon. And what these do is they try and soften the cervix and open artificially. So you may have heard of something called prostin. That's one of the pessaries that we sometimes use. And the other one is propess as well. And like I said as well, sometimes we use the balloon. The second stage of the induction is if after using these methods, the mum hasn't actually gone into labour by herself at this point, because sometimes what happens with an induction is you get a little bit of the drug and then the contractions start and then that's it, you go into full-blown labour and you don't need anything else. So if you don't then go into labour after having a pessary or a balloon to try and open the cervix, what then happens is if the cervix is open but there aren't any contractions and there's no sign of actual labour, is we then would try to break the waters, and this is also known as an artificial rupture of membranes, and the abbreviation is ARM, but most people will say ARM. You know, if you're a mum, you look in your notes and you see ARM and you would say ARM. So breaking the waters again involves an internal examination, and the midwife or the doctor or whichever medical professional you are having attend to you will use a little hook, almost like the end of a crochet needle. Can I say, Nikita? Do you think that's about right?
No, that's
it looks like the end of a crochet needle, and they sort of go in and try and just pop the waters, which is the balloon of membranes that surround the baby, to release the waters in the hope that that will get the labour going. If after that the labour still isn't going or the contractions still haven't started, the last thing that we would then use is the syntocinon drip. So I hope that we can do a whole session on oxytocin at some point, but syntocinon is the artificial hormone that we all produce that helps us to contract naturally. So the drip will then be started. So one thing I want to point out about induction of labour is when some mums accept the induction and they think they're going ahead with this induction, they are sometimes, maybe because they haven't asked or maybe they just assume, I think they are sometimes led to believe that these things will happen quickly. But all these processes, if you choose to accept an induction of labour, can actually take a few days. And it could be that even when you use all of those methods, the labour still doesn't start. So I'll leave that there for now. I'm sure we'll come back to that later. But do you think that answers your question about how is an induction carried out?
Yeah. And I think people need to know that sometimes if you're using the first method, that you can go home and wait for it to start. It doesn't all have to be in hospital. So if you're using a pessary, you can go home and wait for your contractions to start. But with an artificial rupture of membranes and the syntocinon, you do have to be in hospital for that.
Yeah, absolutely.
So now we're going to talk about, is induction always necessary? Lola, do you want to start with this?
Yeah, I can start with that one. Okay, so I think that if I'm going to be perfectly honest, I will say there are definitely circumstances in which an induction is strongly recommended. So, for example, if you have medical complications, there are some medical complications that, if it gets serious, the only way in which the mum can be better and the baby can also be, you know, born in good condition is to have the baby born. And so when it comes to things like that, you would be then looking at an induction of labor. So, for example, in cases of severe preeclampsia, it can sometimes get to the point where the only safe thing for the mum and the baby is for the baby to be born. The reason I sound a little bit hesitant is induction, even in those situations, is not always advised. So if the situation is really, really serious, it might be that actually you don't even have time to go through a labor, and that the only safe and the baby is to have the baby delivered by a cesarean section. And so things like cholestasis, which is a condition that some people develop in pregnancy, and gestational diabetes might be a reason why you might consider having an induction over waiting to see what happens. So what I would say is, if you are ever thinking, or if you ever get into that position where you are being spoken to about induction of labor, you absolutely need to look at the whole picture. In an uncomplicated pregnancy, where there are no underlying medical conditions and there are no concerns about the mother and no concerns about the baby, I would personally say that it would be the mum's choice whether or not she wants to be induced or not. Some people get to that stage.
Choice, she needs to have information.
Yeah, she does need to have information, which is why I say if you have no complications at all, then I would say absolutely you need all the evidence. But if you do have medical, if you have medical issues, then you need to listen to what the medical team are telling you, as well as making that decision. Do you see what I mean? Like, I think there are some situations where you maybe might need to listen a little bit more to what the medical staff are telling you. And there are some situations where you think, well, actually, I've had an uncomplicated pregnancy, everything seems fine, I'm not sure about this induction. So you're absolutely right. You need to have the information to make an informed choice. And I think maybe that's sometimes where we fall short, is giving people an unbiased view of both sides of the story.
Yeah, and I definitely urge people to, you know, to make their own mind up. Of course, what Lola said is true. You have to listen to what the medical practitioners are saying, because it's necessary, but you also have to do your own research. And I would really point people in the direction of going to the website called AIMS, which is the Association for Improvement in Maternity Services. They have so much info for you to look at. They have a book that you can buy called Am I Allowed? That was written by Beverly Beach. So they will talk about many obstetric scenarios where you are told in the normal system that you have to, or you're not allowed to do something. And this is a great place to get information for the facts, for evidence-based research. Would you agree, Lola?
Yeah, I would agree, but I would also add as well Dr. Sarah Wickham. So yep. I'm not really sure what her website is, but I'm pretty sure it's sarahwickham.com. She has a lot of evidence-based information. I know she definitely has a book on things like induction of labor, and she gives a very balanced view of both sides of the story. So if you ever get to a point where you're a little bit confused, then those are really good resources that you could tap into.
And to Birthrights UK as well. That's also a very good website to go to if you're confused or you need any assistance. Or even if you want to write a letter to, say, your consultant midwife to talk about your options, AIMS will always help you. Just write a letter or give you evidence to put in your letter to help you get the birth that you want. So I would definitely urge you to do that.
And I think it's a really good thing that you brought up the consultant midwife thing, because I think sometimes when we're talking about these issues, we completely forget that there are members of staff within the hospital that are employed to do these things. So I completely forgot about that. But absolutely, if you have a consultant midwife at your local unit, then please do go and speak to that person, because again, they will sit down with you and talk to you about anything that you might be concerned about, and hopefully give you a balanced view of the pros and cons of either way.
Yeah, absolutely. So Lola, let's discuss a very common reason for induction, which is overdue, and I will put that in inverted commas because to say you're overdue is well. Would you like to explain why that's a bit strange?
Okay, so like Nikita was talking about, the most common reason for induction of labor is the fact that your baby is overdue. Okay, and when I am talking about this as well, I would just like to say that we are talking about women with uncomplicated pregnancies who have no other health risk factors. So the most common reason that most hospitals will ask you to come in for an induction is for you to be overdue. So from hospital to hospital, it varies a little bit. Most hospitals will go for about, you get to 40 weeks, and after that 40 weeks, you have about a week and a few days before they start talking about an induction. So we're talking about 40 weeks.
Is normal, and we have to bear in mind that 40 weeks was actually coined by a German physician based on the lunar calendar. And sometimes it's very normal for a woman to go up to 44, 45 weeks, but unfortunately we don't really see that anymore because of the rate of induction. So we have to decide what normal is first. You know, like Lola just said, a lot of hospitals, if you go over 40 weeks, they will want you to be induced. Some will let you go to, well, 42, some do, don't they, Lola, or 10 days.
That, you know, on average, I would say that hospitals would recommend induction between 40 weeks and 10 days to 40 weeks and 14 days. So exactly 2 weeks past the 40 weeks. Okay. So that's one thing that you need to consider. What I always say to mums who come to my antenatal classes is, if you ever get to the point where you are beginning to think that you do want to be induced or you don't want to be induced, or you're unsure about anything at all, think about what we are saying when we say our estimated date. It's an estimate. So nobody really knows that 40 weeks is absolutely the time that this baby needs to come out, okay? When I say this, I am not trying to encourage you not to take on an induction of labor. I just want you to be able to think about the options that you have if you get to that point and you're feeling that you don't want to be induced, or you're feeling that you are being pushed into it. So the estimated date of delivery is definitely an estimate. The baby can come weeks before then and weeks after that, okay? I think things to consider is, as a hospital, if they are offering induction, they have to set a date for when they have to set it. In a way, I guess what I'm trying to say is they have to set a general date. But that doesn't mean that everybody's going to fall into that date. That just as it doesn't mean that at 40 weeks when we say, okay, this is the end of your pregnancy, that doesn't mean you're not going to have this baby before or after the 40 weeks. So it's the same thing. So if you ever feel that you're in a...
Why they want to induce you? So why over 40 weeks? What do they worry about? What do women need to know that the doctors are worried about?
So I would say that what the medical profession and the obstetric team worry about is the fact that when you get to a certain point in your pregnancy where they think that the baby is mature, there is suggestions that the placenta does not, the placenta starts to be less efficient, okay? So from the obstetric team's point of view, what they don't want is to have a baby that comes out in a poor condition because the placenta might have started to lose its function a bit. So that's where it comes from, that sort of the need to, or the suggestion or the advice to induce your labor once you get to a certain part of your pregnancy. It comes from the fact that the placenta is not as efficient. Now, what I think is really interesting is the last time I did some reading about induction of labor, I do love reading the evidence, because sometimes you look at things and you think, what did I just read? And you can sit there reading the same sentence for 20 hours and it still reads as something that you find really confusing. So I remember once when I was reading about induction of labor, and it was saying in babies that are over 40 weeks, there has been evidence to suggest that the placenta is not as efficient. Then it went on to say that that's not to say that at 40 weeks the placenta is not efficient. So I was like, what does that mean? I don't understand. And I think what
Yeah,
they
I
were
get
trying
that,
to
yeah.
say is, do you understand what I'm saying?
I do understand. It's like saying, okay, so I think the analogy would be breastfeeding. So the
Yeah.
World Health Organization says there's no nutritional value, say, after 2 years. So
Mm-hmm.
that's not to say that the milk is still not serving a purpose, because
And
yeah. So yes, the placenta might not be as efficient, but it's efficient as it needs to be over that gestational period. Is that what they're saying?
I think that's what they're saying. But again, what I really want mums and their families to get from this is, don't get too wrapped up in the science of it. It's about understanding what your choices are. Would you agree? It's not, nobody's asking anybody to be a rocket science or have a master's in placenta here. We are just trying to give you the options that actually the reason for induction is that obstetrically, we are suggesting that maybe once the baby gets mature and you go over a certain number of days, the placenta is less efficient. That is not to say that every single baby that goes to 2 weeks, like 42 weeks, 43 weeks, is going to have an inefficient placenta. So if you decide that you don't want to go ahead with an induction, there are things that you need to look out for. So it's the whole story. Do you feel well? Is your baby moving okay? If you are not wanting to take on the induction, then what? Have a plan for not wanting to take on the induction. Don't get too bogged down by the evidence coming from here, the evidence coming from there. But if you are unsure about things, what we are saying is that there are resources that you can tap into if you are unsure about things to help you on your way. Does that kind of make sense?
Yeah.
If I just blabber
No, it does.
a bit?
It does. I think it's, women also need to go with their gut instinct as well. You know, do they feel? Do you want to be induced? If you're having a perfectly healthy pregnancy, your baby's still moving around. You know, you're not leaking waters constantly. Do you want to be induced? If the answer is no, don't do it. You don't have to. You don't have to be forced into anything. There is no such thing as you are not allowed or you have to. Okay, so to summarize this episode, we'd leave you with a few points. First, the definition of labour, induction of labour, sorry, is, Lola?
So the definition of induction of labour is when we, as an obstetric team, start your labour medically without it starting naturally.
Okay. And point two, you know, sometimes inductions are necessary for medical reasons. You know, if you've got, like we mentioned earlier, preeclampsia or a uterine infection, for example, but they are not always necessary. Would you agree with that, Lola?
I certainly would agree with that. So again, just to repeat what Nikita said, the inductions can be advised on medical reasons, but they are not always necessary in an uncomplicated pregnancy.
Okay, brilliant. And the third point is, you know, if you're going to choose to be induced, you must make sure you're well informed, do your research, and remember, it's always, the final decision is down to you and no one else gets to decide. Would you agree?
Absolutely, I agree with that as well. So in the absence of any medical complications, if you as a mother are well, if your baby is well, you do not have to agree to an induction of labour, but make sure that you are well informed, ask questions at your appointment, write down questions before you go into your appointment so you don't get flustered and forget. And if you leave the appointment feeling that you still haven't had your questions answered, make another appointment to come back or utilise your consultant midwife or your community midwife for more information.
Yeah, also feel free to comment below and we can send you links to various other organisations such as AIMS and Sarah Wickham that we spoke about earlier. Another point would be to be aware that an induction can be a long process. It can take a matter of days sometimes if it works at all. And a large portion of inductions will end up in a caesarean section. So please be aware of that before you choose to be induced.
Yeah,
And,
I would completely agree with that.
Finally, there's a common question that we're often asked is a stretch and sweep, which is where the midwife will sweep around your cervix and the membranes to try and start labour. Is that considered an induction, Lola?
So it's not considered an induction. Like we said at the beginning when we were talking about the definition of an induction being a labour that is medically started rather than starts naturally. There are also other ways in which you could try and get your labor going by natural means. So I would say stretch and a sweep is probably the least medical, but I would also see it as an intervention. So sometimes when mums get to the point where they're overdue and they would like the labor to start, the midwife might offer you a stretch and a sweep, which is an internal examination. The midwife tries to find your cervix, and if the cervix is somewhere reachable, she will then sort of put her fingers in the cervix and just literally make a sweeping movement around the cervix in order to try and stimulate the hormones that kickstart the labor. Now, I will always say, medical or natural, any way in which you try to kickstart your labor will not work unless your body was halfway to getting there already. Would you agree?
100%. Nothing will work unless it's going to work, if that makes sense.
Yeah,
If
nothing
your
will
body's
work
not about to start labouring, there's no amount of hot curry or walking or sex that can do to start your labour. So surrender.
Absolutely surrender. And so with the stretch and sweep thing, again, like an induction, it can completely fail. The midwife might not be able to get to your cervix. If your cervix is way up high and really far back, the midwife is not going to be able to get to your cervix to sweep the cervix anyway. I say this particularly because I know that women sometimes get to the point where they feel uncomfortable and they're about 38 weeks and they think, okay, well, this baby is a term baby, it's healthy, it's ready to come out, I'm going to ask my midwife to do a sweep. I always would say, please, 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 just wait those few weeks more for it to happen naturally.
Absolutely.
I would definitely not be recommending a sweep until you are at least a week over. Personally, from my point of view, I would say it's not worth doing unless you're at least a week over. But that's my personal opinion. That's not medical advice. And I just want to reiterate as well that the conversations that me and Nikita are having are just to broaden your minds a little bit. They are certainly not in lieu of any advice that you might be getting from your midwife or your obstetrician or your doula or anybody else that is looking after you in your pregnancy. It's just to give you a little bit of extra information to go by.
Yeah, and just to go, point you in the right direction of questions to ask, research to do. And I also want to make a point as well, because a lot of women say this to me about what you were saying earlier about, nothing's going to work unless your body's ready. Right, picture this. So we are told that methods of a natural induction involve eating hot food, having sex, going for long walks. If they really worked, you would be advised never to do that during your whole pregnancy. Otherwise you'd start, going into labor at 26 weeks if they really worked. So they will only work. They will only assist you if the catalyst has started in the first place. So don't take it so seriously. So
and just on a final note on the hot food thing, I always advise people that come to my classes, if you are not somebody who eats hot food, do not start at the end of your pregnancy. It is not a good look when you come in to have a water birth. Please do not try and do this if you are not used to hot food.
Yeah, I've seen that a lot. Or castor oil.
No castor oil either.
Okay, I think we're going to wrap it up there. Thank you for tuning in, and we will see you next week on the next episode.
Absolutely. Thanks, guys. Bye-bye.